Hi there, welcome to our Endometriosis Awareness Speaker Series. My name is Angelique Montano-Breslin and I'm a registered physiotherapist practicing in pelvic health at Proactive Pelvic Health Center here in Toronto. And I'm here with my colleague, Jasa Sulit.
Hi, I'm Jasa and I'm an occupational therapist here at the Proactive Pelvic Health Center, and I teach mindfulness here. I'm a qualified mindfulness-based stress reduction teacher as well.
So today we will be discussing pain with endometriosis and how mindfulness can be a really great tool to help manage symptoms of endometriosis. So sit back, relax, and enjoy the talk. So as we get started here, you'll see on one side of your screen the slides that I will be reviewing, so please feel free to follow along. I'm going to start by going through the statistics with endometriosis and pain. In the literature, we're finding that 1 in 10 women, or about 10% of women between the ages of 18 and 44, will be affected by endometriosis. Endo is also the third leading cause for gynecologic admission to hospital. And about 20% of women with endometriosis will also have a comorbid pain condition. So some examples of this would be IBS, or irritable bowel syndrome, interstitial cystitis, as well as fibromyalgia and migraines is another very common one. Regarding the diagnosis of endometriosis, this is where we start to see a little bit of a delay in time frame. And part of the reason for that is there is a lack of biomarkers or tests that are non-invasive in nature to be able to diagnose endometriosis. So to really get a confirmed diagnosis, there has to be some sort of laparoscopic surgery or exploratory surgery to be able to get that confirmed diagnosis. And unfortunately, not all women have access to this sort of surgery, or there may be a backup in the healthcare systems to be able to access this sort of surgery. If we look at the literature, it's over 6 years from the time of onset to the time of diagnosis for endo. And so that's a really long time. I think this is where, as a society and as healthcare professionals and as women living with endometriosis, can be great advocates for themselves so that you're able to access the appropriate care a lot sooner and to be able to get those treatments started as soon as possible. So, as we can see, endometriosis is a persistent pain condition, and 65% of women with endometriosis will have pain. So yeah, there are some women that don't have pain with endometriosis. Some women will develop chronic pelvic pain and others will not. And it's also important to note that this is a chronic condition. However, it may not be progressive, and in some cases can actually go into remission. Okay, if we look at the stage of endometriosis, pain is not necessarily related to the stage of endometriosis. So someone with a stage 4 endometriosis may not necessarily have as much pain as somebody with a stage 2, but this could be vice versa as well. And women that have pain with endometriosis will also experience their pain in a very variable way. The type of pain that a woman feels and the location of the pain may not be the same from one woman to another. The one consistency that is shown within the literature is that deep infiltrating endometriosis is consistently associated with chronic pain. Okay, so we do want to go over a little bit with regards to defining pain and what pain is, because we find that in the research, if we're able to understand our pain better, we can actually feel better as well. So what is pain? If we look at one definition, and this is a definition from a pain researcher in Australia, Dr. Lorimer Mosley, he describes pain as an unpleasant feeling felt somewhere in the body that makes you want to escape it. So it is a feeling, and it makes you want to escape it. You want to protect the body against something. Another definition from the International Association for the Study of Pain, is an unpleasant sensory and emotional experience associated with actual or potential tissue damage or described in terms of such damage. So we're going to touch on a couple components of that definition in just a couple slides. We also want to consider the type of pain that we're dealing with here. So kind of delineating between acute pain and chronic pain. If we're looking at acute pain, we're looking at pain that is of recent onset and limited duration, and not really lasting more than about 8 to 12 weeks. It's usually quite tissue-based, so after having an injury or some sort of trauma or surgery. And when the tissue resolves and then when the tissue heals, the pain goes away. So an example of this would be a woman that has just had a laparoscopic surgery or an exploratory surgery, and those first couple months post-operatively, we're looking at acute pain and healing. And pain that persists after those first 3 months, we're going into what we consider as chronic pain or persistent pain. So the pain that persists or tends to recur for more than 3 months is chronic pain. And typically the tissues have healed, but there's still pain that is present. And this is where we tend to start to see some changes or alterations in the pain processing by our nervous system. And sometimes with this altered processing, we can see an increase in sensitivity of tissues generally, even though the tissues are healed. So when we look at pain, pain will definitely influence our behavior. We tend to create protective mechanisms as well as responses when it comes to pain. And some common ones are the ones listed here. So fight, flight, or freeze, those are more of the automatic responses that the body will create when there's any sort of sense of threat or danger. But there are other ways that we will also behave if we are in pain. And some of them include things like trying to find help, so joining a support group, or trying to seek out a specialist in endometriosis, or addressing dietary concerns, or seeing a psychologist or a physiotherapist to help with pain on many different levels. And we also try to figure out what's wrong. So we may even do our own research, join forums or Facebook pages. So behavior tends to change depending on the way we feel we need to manage our pain. So just like the experience of pain with endometriosis can vary from one woman to another, the way we respond and the way we behave when we're in pain can also be quite variable. So I want to just go over a few key concepts with regards to pain. And the first concept is that pain is real. So if you have pain, it's real. There are far too many women out there that have been told their pain is all in their head. And I think this really needs to stop. Pain is real. Our central nervous systems are real. They're part of our anatomy. Our spinal cord, our brain, all of the nerves within the rest of our peripheral system. This is a real part of our body, and our pain is produced by our nervous system. Changes can occur within the physiology of our central nervous system when we're in persistent pain. So if you're feeling pain, it's real, and it's produced by our central nervous system. An example of this would be a study that had a group of women with endometriosis and then another group which acted as a control group. And what they found with this study is that women that were exposed to a noxious stimulus, the women in the endometriosis group actually reported pain much sooner with a lot less pressure on their skin. And that can be an indication that there's an increase in sensitivity of our nervous systems. So if we think of our nervous system functioning at a baseline level of function and activation, there's always a little bit of electrical activity in our nervous systems. So somebody that has not suffered from persistent pain may be functioning at, say, this level. Okay, and somebody with endometriosis or any other sort of persistent chronic pain condition may be functioning at a little higher levels. So the activation at baseline for our nervous system tends to be higher if you've been in pain for a long time. Now, if the threshold for pain to be experienced is up here, you can see that the buffer between the person with persistent pain and reaching that threshold, that buffer is a lot less and will occur a lot sooner than somebody that is at a kind of more regulated, stable, low-level activation of the nervous system. And so this is exactly what's happening within this study. These women with endometriosis being slightly higher and a little bit more activated at baseline are reaching their pain thresholds a lot sooner and with a lot less noxious stimulus to their body. So the next concept I'd like to go over is that pain is not necessarily indicative of the state of your tissues. So we know that this is true because if we think of an innocuous stimulus, it can still create pain. A good example of this within the endometriosis population is penetrative intercourse and having pain with penetration. So physical attempts at penetrative intercourse may be painful for some women. And of course, that would make sense. There's pressure, there's actual tactile sensation on the tissue, and we can see how that can be noxious. Some women in persistent pain may start to experience pain even without having penetration. So they may even just think about penetrative intercourse, and that is threatening enough to the nervous system to create pain. So just the thought of something that is unpleasant or the thought of something that is dangerous to our systems or threatening to our systems can create pain, and this has nothing to do with the state of our tissues. So some women, months and months after a laparoscopic surgery, again, those tissues can be fully healed, but they still may have that increased sensitivity to touch or be in situations that just tend to ramp up pain when the tissues haven't been involved at all. So we want to take this into consideration. It's just another way of our bodies trying to overprotect because it feels like it needs to continue to protect, when in some cases it doesn't have to do such a good job of protecting, and it just ends up being a little bit more of a problem because it's overprotecting you. So the third concept on your screen is the last one we're going to go through today, and that is pain may change depending on context. So it is influenced by many biopsychosocial factors. So if we're looking at context here, we're looking at things that include, a change in environment, a change in your thoughts or your beliefs, a change in the way you feel or what you smell or what you taste or what you touch. All of these different changes within your environment can actually alter pain experience. And context also changes from one minute to the next. So as a result of this, pain can tend to change as well over time. If we look at the factors, these biopsychosocial factors, really big word, but if we break it down, if we look at the bio part of that term, we're talking about the biologic or the physical parts of what can influence pain. So with endometriosis, examples of this can be or can include inflammation in the tissue. It can include restrictions or adhesions and the scarring as a result of surgery. And it can also just be the physical surgery itself that can be part of this bio sort of physical aspect or factors to consider. The second part of that word is the psych or the psychological part. And here we're dealing more with the cognitive piece. So things like, what you believe, what are your thoughts, what are your expectations and your feelings with regards to your pain, and how well do you understand your pain. All of these sort of cognitive aspects can influence your pain experience. So if we look at some of the research regarding this, what they found is that sadness can actually increase your pain experience, and things like joy and laughter can increase your pain threshold. Part of that is because of the endorphin release in your body, and so it can definitely alter pain experience. And this is where we also see that really strong link between presentation of pain and emotions. And when we have pain, there are many parts within our brain that are activated or that are involved in that kind of production of pain. And some of the parts that are involved are our emotional center, as well as areas in the brain that are involved in stress responses and fear. And so there's definitely this back and forth link between pain and emotions. And the last part of this word is the social aspect. And here we're looking at things like your support systems within your life. So, your family or your partner, are they supportive? Your work environment. So do you like your work? Do you have a lot of stress related to your work environment? And it can also involve, feeling supported or not very supported with the medical system. So kind of things within our society can also influence the way we feel and our pain experience. So the last thing I think I'll leave it at this last slide is we've already touched on this a little bit, but other things to consider when it comes to endometriosis and pain. Anxiety and depression are very prevalent in this population. If we look at the research, we're looking at percentages over 80%, and that is huge in endometriosis. And so we can't ignore this piece of it. And as I just mentioned, there is this massive link between emotions and pain. So anxiety can definitely increase pain experience. So when we're thinking about treatment management for endo, we want to kind of look at it a whole picture. We want to look at a multimodal sort of approach to treating this condition. That may involve a medical doctor or specialist and medical management. That may involve physiotherapy as well as psychotherapy or seeing a psychologist. It also may involve exploring, dietary factors that may increase inflammation in the body. And this is also where mindfulness meditation can be a really great adjunct to treating the symptoms of endometriosis. There is a lot of research out there to show that mindfulness can help reduce chronic pain as well as anxiety and depression. So it can really be a great addition to managing your symptoms. So on that note, I am going to pass it on to Jasa Sulit. I think one last thing I want to leave you with is that our bodies and our nervous systems are very resilient, and things can change. And if you are struggling with pain, I just want you to know that there is hope out there and that there are options, and just don't stop trying and don't stop working on it. There's definitely hope, and we are very resilient. Thanks for listening.
So, what is mindfulness? Well, I'd like to share with you 3 definitions. The first one is one of the oldest definitions of mindfulness, and it's in Pali. And it is to remember. Remember what? Remembering the moment. Where is my mind? What am I paying attention to right now? What was I supposed to be doing? The next definition is by Jon Kabat-Zinn. He says that mindfulness is the paying attention in a certain way, on purpose, in the present moment, non-judgmentally. Carla Naumburg says that mindfulness is about choosing to pay attention to the present moment with kindness and curiosity. So, with those definitions I've shared, you may notice the commonalities in the description, which is it's all about being in the present moment. There's an intentionality, a choice to meet the present moment with an open mind and an open heart. Now this next slide, I'm sharing an image of a person and a dog. And if you take a look at it, you may notice that the dog is quite mindful, present in the moment, whereas the person is not so mindful. Instead, the mind is full of thoughts of the past and the future, all the things we should do. And so this is quite normal for many of us. If you were to think about your day so far, how much of your day up until now were you on autopilot? Maybe getting out of bed, getting ready for the day, making your breakfast, showering, putting your clothes on, all these things we do habitually with our mind elsewhere, we're able to do it on autopilot. But if you think of a car that's on autopilot, who's in control of the car? The car or the driver? And so this makes us think about when we live our lives on autopilot, how much we are doing just because it's been ingrained in our bodies, wired in our nervous system as these patterns of habit. And when we live in that way, we're not exerting our freedom to choose how to respond to each moment. So, how does mindfulness help with pain specifically? Well, in changing the way we relate to the moment, we can change the way we relate to the pain in the moment. And that's definitely easier said than done, especially when pain hurts. Pain is unpleasant. It's an unpleasant sensation. So how can I even be in a relationship with pain? Why would I want to be in a relationship with pain? Well, Jon Kabat-Zinn shares 7 foundational attitudes of mindfulness. And it is with these ways of being open to meeting the moment that we can then develop a relationship with pain. The 7 attitudes are beginner's mind. Beginner's mind is the curious, fresh eyes, new eyes, a way of meeting the moment as if for the first time. Non-judgment. Instead of seeing the moment through the filters of our judgments, this moment should be, this shouldn't be, good, bad, our judgments are filters preventing us from being able to see the reality of the present moment as it is. Acceptance. This is not about loving the moment, loving your pain or liking it. Accepting pain is about acknowledging the reality that this sensation is here and choosing to allow it to be here. So acceptance is not about loving or liking or giving up. It's about the choice to allow what's here to be here instead of choosing to resist. Trust. Trusting that this sensation, just like thoughts, just like my emotions, just as it comes, will go. Trusting that this sensation, just as it has come, will also pass. Trusting in our ability to cope in challenging moments. Trusting in your inner resources for strength, courage, and compassion. Trusting in the body's ability to heal. Patience. Patience is knowing that this too shall pass. And patience is a form of wisdom that knows that all things will come in time. So I may not be where I am today, but with patience, I will be where I want to be. Non-striving. Of course, we're all striving to meet our goals because as human beings, we want to achieve. But in always striving, we never take that moment to meet ourselves as we are right now. So wherever you are in your journey of recovery or healing or leadership and personal growth, whatever it is you're trying to achieve, non-striving allows us to be okay with where I am right now. And finally, the last attitude is letting go. Instead of expecting this moment to be as it is, can I let go of how this moment should be and just meet this present moment and see what it may have to offer? So letting go, just the way we cannot hold on to the breath. If you hold on to the breath, we would die. But when we let go of that exhale, we're able to receive that next inhale. And so with these 7 attitudes, we're able to open ourselves to meeting the moment as it is, meeting the pain that's here as it is, changing our relationship with pain. So instead of our autopilot, habitual reactions to pain, our habitual ways of resisting, turning away, ignoring, distracting ourselves with fear, sense of danger, no sense of control, mindfulness helps us to look at the pain, be with it, acknowledging the reality that this pain is here, and in turning towards it with curiosity, beginner's mind, perhaps there will be something I will understand about this pain that will help me to then respond to my pain. In that way, in this choice to turn towards the pain, opening to it being here, I then have a sense of choice, a sense of control. And with this new relationship and being with pain, we down-regulate the nervous system, which then decreases our sensitivity to pain. And the science is there to support the benefits of mindfulness in chronic pain. Decrease pain intensity and sensitivity, a decrease reactivity to the pain. There's even a decrease in our misuse and craving to opioids. And there's also changes in the brain associated with all of these changes in pain. There's also a specific study on mindfulness with women and with chronic pain, showing an improvement in pain scores, physical function, mental health, and social function. So great, we're hearing all of the benefits, but then how do we bring mindfulness into our lives? How do we cultivate mindfulness? Well, like anything else that we're cultivating, it requires daily practice. And there's 2 types of practice, formal and informal. The formal types of practice is the kind of practice where you have to formally take time out of your day to do, whether it's 1 minute, 10 minutes, or 30 minutes. So I would take 5 minutes to do a sitting meditation, or 10 minutes to do yoga, or 30 minutes for a body scan. So you're taking formal time out of your day. But if not just as important, but more important than the formal practice, is the informal practice. These are the things that you're doing throughout your day, where whatever you're doing, you're going to bring the qualities of mindfulness to that activity. So mindful brushing your teeth, mindful bathing, mindful commute to work, mindful taking stairs, mindful meetings. Whatever it is you're doing, just as what you're doing right now listening to this, are you aware of how your body is feeling, what you're thinking, what you're seeing and hearing, with the curiosity, accepting, non-judgmental, patient, trusting qualities of mindfulness. And with practice, we get better, and research shows we do change the brain and the nervous system, changing our experience of pain. So let's try it. We're going to do something called the breathing space, which I encourage you to do every day. This can be done in 1 minute, 3 minutes, 5 minutes, but there's 4 simple steps. The first is to bring awareness to your body. Secondly, how you're feeling emotionally. And third, what thoughts are on your mind. Second step is to focus on the breath. Third step, expanding your awareness so you're aware of the whole body. And the final step is a self-care step. So I invite you now, whether your eyes are open or closed, if you're standing or sitting, you can do this breathing space in any position. I invite you with the curiosity and non-judgmental, accepting awareness that mindfulness is, bringing awareness to how your body is feeling. Maybe asking yourself, how is my body feeling right now? What sensations are here in your feet and legs, hips, pelvic area, torso, arms, legs, head and neck? And I invite you, no matter what sensations are here, pleasant or unpleasant, can you put the welcome mat out? Even if there's unpleasant sensations, can we acknowledge the reality of what is here? And with the fresh eyes of a child meeting something for the first time, if there is an unpleasant sensation, turning towards it, perhaps even breathing in towards the unpleasant sensation, not because we're striving to relax or change the pain, but because we're breathing in to support and acknowledge that unpleasant sensation. And if you notice your mind has wandered to a thought, great, you've noticed. And if you notice the mind judging, we don't judge the judgment. I invite you to bring your awareness back to the body, noticing how you're feeling right now and continuing to welcome your body to feel as it's feeling right now, even if it's not feeling pleasant. We're practicing being with ourselves as we are, no matter how we are, using the breath to help guide you be here in the moment. And now acknowledging your emotions, asking yourself, how am I feeling right now? What emotions are here? Maybe you're feeling excited, angry, anxious, stressed, or maybe you're feeling excited and happy. Whatever you're feeling, continue to put that welcome mat out, allowing all your human emotions to be here without judgment, but instead allow yourself to feel the freedom of feeling all emotions, acknowledging it with acceptance. And now finally taking a moment to notice any thoughts that may be here, acknowledging the universality of a mind that thinks, a mind that wanders. Maybe you're having thoughts of the future or the past. Mindfulness is not about not thinking, it's about being aware of what you're thinking with beginner's mind and non-judgment. And now coming to the breath. Where do you feel the breath most vividly? Maybe you feel it in your nose or your throat, or perhaps your chest or your belly. Noticing your inhale and exhale. And notice how your breath is always happening in real time. And that's why the breath is such a great tool to use to anchor us to the moment, because if you're aware of your breath, you're automatically aware of now. Next, expanding your field of attention so you're aware of your whole body now, from head to toe. Front of your body, back of your body, left side, right side. Aware of your whole body, breathing in and breathing out. And the final step in this practice is asking yourself, what do I need for myself right now? How can I best take care of my needs today, tomorrow, this week? How can I nourish my mind and my body? And so that was a breathing space, which you can do several times a day, anytime, anywhere. At home, in the car, at work. And I'll leave you now with some resources. As you'll see on the slides here, there's some free guided audio that I have on my SoundCloud account. There's also many apps. One of my favorites is Aura, and another one is called Headspace. Headspace is a great one with some videos that really help us to envision what we're doing when we're practicing mindfulness. And a couple books here by Jon Kabat-Zinn and Thich Nhat Hanh. And finally, I'll leave you with a notice for my upcoming mindfulness-based stress reduction workshop. It's the 8-week course that I took for myself when I had chronic pain and stress and anxiety, and we'll be holding that here just off the Danforth on 257 Danforth, and it starts March 26th, ending May 14th. And if you're interested in registering that, you can just email info@proactiveph.com. Thank you so much, and if you have any questions, feel free to email me or Angelique here at Proactive.